Assalamu alaikum. My name is HAMMAD Majeed and I am from BS Physics Department. Today my topic is phytochemistry of Ashwagandha. Phytochemistry is the branch of chemistry that deals with the study of phytochemicals which are derived from plants. These will be the major outlines that I will be discussing with you today. That includes from introduction to Ashwagandha and to the major role it played during the development of COVID-19 medicine. Introduction to Ashwagandha. Since its inception in 6000 BC, Withania somnifera, popularly known as Ashwagandha in Sanskrit, has been extensively implemented as herbal medicine and evergreen woody shrub of the Solanaceae family. Withania, Withania somnifera has been assigned several names with distinct meanings, such as Indian winter cherry or Indian ginseng in English, Paneer or Asgandh in Hindi or Asgandh in Urdu. Ashwagandha is the name given to the plant since Ashwa means horse and Gandha means smell, as the root possesses a characteristics of a wet horse smell. The species name has been ascribed as somnifera, which means sleep inducer in Latin, owing to its prodigious antistress characteristics. Ashwagandha has been tremendously used as astringent, anticarbonical, anti-stress, tonic, narcotic, diuretic, and against worms, piles, goiter, leukoderma, nervous breakdown, insomnia, and constipation. It is the root of plants that have been extensively used in Unani and Ayurvedic systems of medicine. Roots are reported to contain 0.13 to 0.31 percentage alkaloids, volatile oils, starch, amino acid, glycosides, reducing sugars and steroids. Besides, the roots leaves are useful to cure fever and swelling. The flower has been used as astringent. Diuretics fruits are used to treat skin ulcers, tumors, carbuncles, seeds are effective in increasing the sperm count as well as in testicular growth. Botanical taxonomic description of ashwagandha. Withania somnifera is an evergrown xerophytic woody, short, tender perennial shrub that grows about 2 meters tall and 1 meter wide. It has tomentose branches covered with short, fine, silver gray hairs that extend radially from a central stem. The stems are brownish prostrate to erect. The leaves are alternate, almost hairless and green at the upper surface and densely hairy underneath. It has dull, simple, glabrous green elliptic leaves and small green bell-shaped flowers. The fruit is an airless spherical berry enclosed in an inflated and membranous persistent calyx, 5 to 8 millimeter in diameter and orange red to red when ripe. The fruit has numerous seeds that are pale brown, kidney shaped, and compressed to a rough, netted surface. The roots are stout, fleshy, bearing fiber like secondary branches arising from the main root, having a strong odor and bitter, acrid taste. Distribution and its traditional use. Distribution of ashwagandha. Withania somnifera is the most widespread species in the genus. It occurs naturally in the drier regions extended from the Mediterranean through tropical Africa, through South Africa and from the Canary and Cape Verde Islands to the Middle East and Arabia, Afghanistan, Balochistan, Pakistan, Sri Lanka, China, Nepal, and India. In the warmer parts of Europe, it is cultivated in gardens, has become a naturalized weed in South Australia and New South Wales. In India, however, it is grown as a medicinal crop mainly for its fleshy roots that possesses a plethora of bioactive compounds having several pharmacological implications. In India, the plant is widely distributed in the drier parts, except in the Punjab, Gujarat, Uttar Pradesh, Maharashtra, West Bengal, and Rajasthan. Traditional uses of ashwagandha are Ayurveda, the traditional system of medicine practiced in India can be traced back to 6000 BC. For most of these 6000 years, ashwagandha has been used as a rasayana. The root of ashwagandha is regarded as tonic, aphrodisiac, narcotic, diuretic, anthelmintic, astringent, thermogenic, and stimulant. It is commonly used in emaciation of children, debility from old age, rheumatism, vitiated condition of vata, leukoderma, constipation, insomnia, nervous breakdown, goiter, etc. The paste formed when roots are crushed with water is applied to reduce the inflammation at the joints. It is also locally applied in the carbuncles, ulcers, and painful swelling. The root, in combination with the other drugs, is prescribed for snake venom, as well as in scorpion sting. The leaves are bitter and are recommended in fewer painful swellings. The flowers are astringent, diuretic, and aphrodisiac. The seeds are anthelmintic and combined with astringent and rock salt remove white spots from cornea. Phytochemistry of ashwagandha. A myriad of phytochemicals has been isolated from Withania somnifera with the aid of separation techniques like column chromatography, thin layer chromatography, high performance liquid chromatography, analysis of methanoic extracts from different plants. Some of these phytochemicals are listed below. These include Vidafrin A, viscoselectin B, and 27 hydroxy withanolide B. Chlorinated withanolides reduced by using an ethyl acetate soluble fraction of the crude extract had been subjected to repeated column chromatography. Finally, the structures were confirmed through single crystal X-ray diffraction experiment. The absolute configuration was confirmed based on anomalous scattering of the chlorine atom in the crystal, was established as 6A chloro 5B 17A dihydroxy with A. Other chlorinated compounds were also confirmed with nuclear magnetic resonance studies, or NMR for short. In the extract of Withania somnifera fruits made in annexane, aqueous methanol, and water, a combination of NMR and gas chromatography mass spectroscopy GCMS for short, identified chemically diverse metabolites including organic acids, fatty acid, aliphatics, and aromatic amino acids, phenolic acid, vithanamides, polyols, sugars, sterols, and tocopherols. The primary and secondary metabolites, including malonic acid, 1-deoxy-dehydroxylulose 5-phosphate, shikimic acid, and phenylpropanoid scoline, and tocopherol, were also reported in the fruits of Vidaria somnifera. According to reports, more than 12 alkaloids, 14 vithanolides, and several cytoindocides were among the numerous constituents found in several parts of Withania somnifera by different phytochemical analyses. Among this wide spectrum of pharmacological active principles, only a few are the key players in exhibiting pharmacological attributes. Vithanolides are an ergostane type of steroidal compound with a delta-lactone functionality present between C22 and C26 atoms and oxidized C1 position. The dominant vithanolides are vithanolide D and vidafrin A. Besides having anti-tumor, anti-inflammatory, and immunosuppressant characters, they are potent antioxidants implicated in the neuroprotection ability of the plant extract. Under in vitro conditions, vithanolide A, epidenocyte 4 and 6 were found to have a role in extension of axon and dendrites. Vithanolide A can reconstruct neuronal networks as well. Besides, vithanolide possesses the ability to inhibit acetylcholinesterase and promote the formation of dendrites in human neuroblastoma cells. These are the different classes of phytochemicals present in Withania somnifera that includes alkaloids, steroidal lactose, steroids, and containing compounds, salts, and flavonoids. Pharmacological properties of plant extracts and phytochemicals. Usage of Withania somnifera has been authenticated after a large number of preclinical trials and pharmacological investigation. The following section depicts several reports, both in vivo and in vitro, elucidating the bioactivities of the various parts of this plant. These include anti-cancer apoptotic activities, anti-inflammatory activities, immunomodulatory activities, anti-diabetic activities, cardioprotective activities, antimicrobial activities, and neuroprotective activities. Anti-cancer and apoptotic activities. Both chemotherapy and radiation therapy cause severe side effects such as vomiting, nausea, alopsia, pulmonary fibrosis, mucosal ulceration, hepatic cardiac toxicity, etc. Drugs that can eliminate these side effects can be a boon for cancer therapy. The cancer effect of Withania has been studied extensively and it was found that it is the most effective agent in preventing the cancer through its ability to reduce the tumor size. The treatment of root extract of Withania somnifera on induced skin cancer in mice exhibited significant decrease in the incidence and average number of skin lesions compared to the control group. Vidoflurin A showed tumor inhibitory activities against cell derived from the human carcinoma of the nasopharynx, and it is also inhibited the growth of roots of Allium cepa by arresting the cell division at metaphase. In another study, Withania somnifera was evaluated for its anti-tumor effect in urethrin-induced lung adenomas in adult male albino mice. Simultaneous administration of Withania somnifera extract and urethane reduced tumor incidence significantly. Anti-inflammatory activities. Withania somnifera has been known to deliver remarkable anti-inflammatory activities in various disease models. Rectal gel application of Withania somnifera root extracts were documented to exhibit mucorestorative mucorestorative, and anti-inflammatory activities by reducing neutrophil infiltration, necrosis, and edema in trinitrobenzene sulfonic acid induced inflammatory bowel disease or TNBS for short. Oral administration of Withania somnifera root extract powder was found to be effective against systemic lupus erythematosus like symptoms, reducing pro-inflammatory cytokinesis, tumor necrosis factor, reactive oxygen species, and nitric acid in female bull mouse models. Immunomodulatory activities. Ashwagandha extracts in Swiss albino mice cause suppression of cyclophosphamide, induced potentiation of delayed type hypersensitivity reactions, or DTH for short, a significant increase in white blood cells count, platelets count, and immunoglobulin mediated anaphylaxis as a reduction of albumin induced edema. Extracts of Withania somnifera were found to be effective in animals treated with cyclophosphamide to reduce DTH. Activity against cyclophosphamide induced myelosuppression and immunosuppression were also observed with significant increase in platelet, white blood cell count, and hemagglutinating hemolytic antibody responses. Cytoprotection against lead toxicity in C6 cell was found by pre-treatment with 0.1% with Henia somnifera extract. Moreover, a 20 mg dose per animal of 70% methanolic root extract increased the white blood cell count, circulating antibody titer, and antibody forming cells, stimulation of the weight of spleen and thymus, and phagocytosis of macrophages. Anti-diabetic activities. Many ancient polyherbal formulations such as Dinex and Trashinian of Indian medicine showed potent anti-diabetic activity in humans. Patients administered with root powder of Withania somnifera were observed to have stabilized blood glucose concentration, that could be compared to the effect of an oral hypoglycemic drug, Daniel, with no adverse effect. In addition to that, Withania's somnifera treatment could significantly improve the insulin sensitivity index in non-insulin dependent diabetes mellitus rats. Aqueous extract of Withania somnifera were found to be effective in decreasing blood glucose, HbA1c, and insulin level. Based on these reports, Withania somnifera roots and leaf extract appear to be beneficial in improving glucose uptake in adipocytes and skeletal myotubes. However, the leaf extract was found to be demonstrate a more pronounced effect than that of a root. Root and leaf extracts significantly normalize the glucose level in urine, blood, tissue glycogen, and glucose 6 phosphatase level in alexin-induced diabetic rats. Phenolics and flavonoids present in the extracts of ashwagandha were supposed to be responsible for the antidiabetic activities. In addition, widofrin A from Withania somnifera could block the inflammatory responses caused due to the cytokine-induced damage to the isles of Langerhans in the in vitro after transplantation, and it exhibited potential anti-glycating activity. Cardioprotective activities. Withania somnifera is known to possess cardioprotective and cardiotropic properties in animal models when administered at 30, 60, and 90 mg kilogram per day as a polyherbal combination containing 50 mg per capsule of Withania somnifera tuber for 60 days. Treatment with Withania somnifera in Wister rats significantly restored the balance between myocardial oxidant and antioxidant, anti-apoptotic and pro-apoptotic effects, and further reduced histopathologic deterioration of myocardium and triphosphate nick and labeling tunnel for short positive apoptosis in rat models. Standard Withania somnifera extracts 1.5% withanolides at a dose of 300 mg per kg prevented cardiotoxicity induced by dextromethorphan and reduced several biochemical changes like reduction in elevated malondialdehyde level, catalase, superoxide dismutase activity, calcium content, BCL2 protein level, antimicrobial activity. Withania somnifera has been used for ages against infection even without proper scientific explanation. Methanoic leaf extract of the plant has shown remarkable antimicrobial activity against gram-positive isolates of methicillin-resistant Staphylococcus aureus and Enterococcus isolated from the pus samples. It has shown that the potential antimicrobial activity against gram-negative bacteria with E. coli, Protosmirabilis, Salmonella typhi, Pseudomonas aeruginosa, and etc. Withania somnifera leaves and roots extracts were reported to increase the synergistic antibacterial activity of tebrim against E. coli and Salmonella typhi. Withanolides containing ethanate extracts isolated from Withania somnifera could induce apoptosis like cellular death in Leishmania donovani by inducing DNA nicks, apoptosis and cell cycle arrest in dose-dependent and time-dependent manner by increasing reactive oxygen species (ROS for short) production and decreasing mitochondrial potential, probably by blocking the protein kinase C (PKC) pathway shown by an in silico study. Neuroprotective activities. Neuroprotective activities of Withania somnifera has been well documented by many studies. Reports obtained from preclinical researches and clinical trials have substantiated the neuroprotective role of Withania somnifera. Withanan found in the leaf extract of Withania somnifera can protect against scopolamine-induced toxicity in both glial and neuronal cells in experimental animals. Withania somnifera extract could further attenuate The toxicity induced by lead in glial cells by balancing the expression of heat shock protein 17 HSP 70 NCAM GFAP and mortallin. Withania somnifera derived glycovithanolides shown marked antioxidant activity in striatum and cortex of the rat brain by inducing an increase in superoxide dismutase or SOD for short, catalase and glutathione glutathione peroxidase activities. The root extracts of the plant have been found to play a pivotal role against anxiety, depression, senile dementia, cognitive disorder, and many other neurodegenerative disorders such as Alzheimer's disease, and Parkinson disease. It is something has also helped in these neurological diseases such as Parkinson disease, Huntington disease, and Alzheimer's disease. Sleep-inducing and anxiolytic and anti-stress properties of Withania somnifera. Sleep has a crucial role in maintenance of the physical and mental health of the mammalian body. Sleep loss or abandonment may culminate in an array of physical, metabolic, and cognitive disturbances that in turn initiate stress, anxiety, obesity, and other neurocognitive dysfunctions. Hippocampus and piriform cortex, two regions of the brain associated with memory and perception, loses their sleep-dependent function owing to the complete loss of sleep. Somnifera means sleep-inducing and thus to validate the role of Withania somnifera in averting anxiety, motor dysfunction, and cognitive dis- deficits in sleep-deprived animals. Magenta et al. Used an aqueous extract of Withania somnifera root to elucidate its sleep-inducing potential. In the study, 12-hour sleep-deprived rats were found to exhibit neuromotor dysfunction and memory impairment which could be reverted with the pre-treatment before sleep derivation with Withania somnifera extract for 15 days. Pre-treatment was also found to improve the alertness and recognition memory and explorative nature among rats. A very recent finding of Lopreste et al. Showed that the daily intake of 240 mg of Withania somnifera extract can cause a reduction in Hamilton Anxiety Rating Scale and Stress Scale 21. Oral administration of Withania somnifera root powder at a dose of 500 mg per kg per day prevented post-traumatic stress disorder PTSD induced memory impairment in single prolonged stress rat model. Withania somnifera has a remarkable quality to reduce the corticosterone levels in treated mice compared to vehicle-treated ones, which were subjected to restrained stress for 30 days straight. A polyherbal formulation, UMIL, containing Withania somnifera as a major component, was demonstrated to regulate cerebral monoamine levels after they were subjected to chronic electroshock stress in rats, as documented by Bhattacharya et al. Umil is also seen to reduce the glucose intolerance and normalize male sexual behavior in rats. Ashwagandha against psychological and behavioral disorders. The patented compound herbal preparation CHP that includes peony alba, somnifera, Withania somnifera, Centella asiatica, Ciprulina plastensis, Bacopa monoieri, and Melissa officinalis are found to improve attention, cognition, and impulse control in children with attention deficit hyperactivity disorder or ADHD for short. Withania somnifera extracts are also improve auditory verbal working memory and social cognition in patients of bipolar disorder with cognitive dysfunction. Furthermore, in a placebo control study with Withania somnifera extract, subtle change in thyroid indices were noted in patients affected by bipolar disorder. Such results open up further research scope in the treatment of subclinical hypothyroidism, especially in patients with bipolar and unipolar mood disorders. Withania somnifera extract showed significant protection property in 30 patients with obsessive compulsive disorder, as evidenced by the Yale-Brown obsessive compulsive scale. Clinical studies of ashwagandha. Withania somnifera, along with Terminalia arduina and Philanthus umbrisca and Ocimum tenuiflorum in a capsule form Cadipro, twice daily improve the condition of coronary artery disease (CAD) patients. Following the treatment, a significant reduction of systolic and diastolic blood pressure was observed, along with decreased serum cholesterol, triglycerine, and increased high density lipoprotein cholesterol without any marked biochemical or clinical side effects. 300 milligram twice a day standardized to 1.5% within a light from Withania somnifera route, along with dietary counseling and deep breathing relaxation technique and standard multivitamins significantly improve mental health, concentration, and vitality and social function, leading to a better quality of life without any serious adverse effect. Standard water extract of Withania somnifera improve cognitive and psychomotor performance in a double-blind, multi-dose, placebo-controlled crossover study among 20 healthy males. Significant improvement in reaction time, choice, discrimination, card sorting, digit vigilance, and digit symbol substitution were noted. A standardized Withania somnifera extract showed in beach 24 mg was daily for 60 days in a double-blind, placebo-controlled randomized study significantly decreased morning cortisol and depression according to Hamilton Anxiety Rating Scale. Toxicity studies of ashwagandha. Withania somnifera is being considered a reasonably safe drug. Several general toxicity studies of extracts of the whole plant parts, and pure compound isolated from Withania somnifera have been reported. In central nervous system study, the acute toxicity LD50 of total alkaloids isolated from the roots were 465 mg per kg and 432 mg per kg in rat and mice, respectively. For testing, 2% suspension of alkaloids was used along with 10% and 2% gum acacia, the suspending agent. The toxicity of LD alkaloid extract of seed was 1750 plus minus 41 mg in albino mice. The aqueous extract of Withania somnifera in drinking water for long-term treatment was found to be non-toxic in rats. The role of ashwagandha during the development of COVID-19 vaccine. The coronavirus disease 2019 or COVID-19 for short is a viral infection that has spread around the world since December 2019. Hence, there is an urgent need to develop a potential therapy to combat COVID-19 disease. A preprint of Balkrishna et al. Predict a vitamin from Withania somnifera could bind with receptor binding domain complex of COVID-19 spike protein and human angiotensin converting enzyme 2 and consequently reduce viral entry. Withania from Withania somnifera was predicted to inhibit COVID-19 replication by interacting with N343 to reduce the spike glycosylation. Four compounds for Withania somnifera have been found to inhibit COVID-19 envelope protein by binding with the pure region and reduce viral replication alongside COVID-19 and aqueous root extracts of Withania somnifera also reduce the tilapia lake virus, mediated stress level and mortality. Molecular docking studies thus emphasize the promiscuous activity of Withania somnifera phytochemical compared with the standard viral inhibitors. Withanacide 2, withanacide 1, withanacide 5, and cytoindicide 9 are found to be bind strongly with the main proteins of SARS-CoV-2. These findings suggest potent antiviral, especially antiviral SARS-CoV-2 activity, but these in silico findings are needed to be validated in vitro and in vivo systems. Conclusions. The available scientific data supports that the ashwagandha is a real potent regenerative tonic due to its multiple pharmacological actions like anti-stress, neuroprotective, anti-tumor, anti-arthritic, analgesic, and anti-inflammatory, etc. It is useful for different types of diseases like Parkinson's, dementia and memory loss, stress-induced diseases, melanoma, and others. Ashwagandha is used as a household remedy by Indians who consider it as the best tonic for old people and children, as aphrodisiac by young people. It is one of the best nervine tonics of the Ayurveda and the most ancient system of medical sciences. Our clinical experiences show that beside the enumerated neurological condition, brain strokes causing paralysis and neuronal deficits also improve in the long-term treatment with ashwagandha. We were also using it in all forms of cancer, including prostate and lung cancer, especially in last stages, giving the patient lots of health benefits. We have some cases of lung cancer who have refused modern therapy and recover clinically and radiologically with our therapy of ashwagandha. In research seminar on essential drug concept, it was projected as one of the 6 essential medicinal herbs. Thus, the above findings clearly indicate that traditional use of ashwagandha has a logical scientific base. Large-scale clinical studies are needed to prove the clinical efficacy of this stress, especially in stress-related diseases and neuronal disorder as cancer. Now, this will conclude my presentation on phytochemistry of ashwagandha. Thank you for listening to my presentation and Allah Hafiz.